So we're very excited to talk to you today about the Access ARP Program Awards. And we're just gonna get right to it because we're short on time today. So we wanna make sure we get to the presentation and then we'll have time for questions afterwards. Next slide. So I'm gonna actually turn it over to Peter with PCD to talk about their role in the ARP award program because you will be engaging with them directly.
So hello, everybody. I'm Peter Busby. I'm a communications manager with Public Consulting Group. I'm also joined by some members of our technical and program teams who helped develop this award program and the application you'll be using. So as it says here on the slide, PCG is a public sector consulting firm that works with health, education, and human services agencies around the country. So Access has contracted with us to help administer these program awards. So what that means is part of our role is providing technical assistance to applicants throughout the application, award, and payment processes. So if you're having any trouble, hopefully we can be the ones to help you out.
Great, thanks, Peter. So our program overview, we have about $40 million to award program these awards to strengthen home and community-based services. We'll talk a little bit about that in a minute as to what populations can be impacted by these awards. These funds are from the American Rescue Plan, and more information is on our Access website if you want to access our spending plan and our other priorities with funding. But our goals with the program awards is to enhance member experience, health, and safety of people receiving home and community-based services throughout the state. And the exciting date is that the applications open on April 17th. Next slide. So a little bit about the funding guidelines. Applicants can request between $10,000 and $500,000 for either a programmatic or infrastructure project. We'll talk a little bit about what that means in a minute. It's one-time upfront funding, and one of the limitations is that the administrative costs cannot exceed 10% of the total request. You can request funds to create a new project or expand something that you have going on existingly. Funds have to be spent by September 30th, 2024. That's our deadline as a state for expending our ARP funds. And of course, any unspent funding must be returned to Access within 60 days of your project end date, which hopefully will be before September 2024. Next slide. So who can apply? This is the list of provider types that can apply for the awards. One thing I want to make note of is under the habilitation providers, that does include the group home providers, which I think is provider type 25. So just wanted to make that note. But these are all the providers that we believe to be able to provide projects or develop projects or expand current projects that relate to our priorities for this award. Next slide. So who can benefit? So we talk about home and community-based services. Generally, we think of just the long-term care population. But when we wrote our spending plan for the American Rescue Plan Act, we included a broader definition and scope of what we refer to as home and community-based services. So this includes people who are elderly or aging, individuals with disabilities, that could be physical disabilities or intellectual and developmental disabilities, individuals living with a serious mental illness and have that designation, and or children with behavioral health needs. So think broader when you think home and community-based services. Next slide. So funding for the program has to support Arizona residents, and this does include any Arizona residents residing on tribal land. The funding can only be used to support people in Medicaid eligible programs, but it's certainly possible that you could have non-Medicaid clients that are participating in a Medicaid eligible program and may benefit if the program mostly supports Medicaid clients. So if you have some folks who can benefit from the program, but the program is still, or project is mostly serving Medicaid members, then that's allowable under this award. And Peter, I'm going to turn it over to you to talk about the application.
No problem. So interested applicants should apply online using Grants Connect. That's just our online grant platform. And as we said earlier, the application will open next Monday, April 17th, and it closes at 5 p.m. on May 16th. So make sure you get your application in before then. You can only submit one application and you cannot make any changes to it after you submit it. The only exception to that is if there's an issue with your application, maybe you missed a section, something like that. In that case, you may submit an updated one for that same project to correct that issue, but that's the only case where you can make any changes. Access and PCG will host a second webinar on April 19th at 12 p.m. on how to use Grants Connect. We'll just sort of talk about the platform, the application, give you instructions for applying. You can find the link to register for that on the Program Award webpage. It'll also be in the confirmation email you receive after this webinar. So now let's just turn to eligible activities for this award program. As it says here, any activities that improve the experience, health, or safety of people receiving home and community-based services in Arizona are eligible, and that includes any activities that do the following. You can see the list here on the right hand of the page: increase engagement in community activities, expand supportive employment and employment skills development, including volunteerism, support member voice and their choice to lead self-directed lives, expand opportunities for social engagement and relationship building, support recreation and health promotion programs that promote physical activity and nutrition, expand technology that improves connectivity and telehealth, create environmental or physical plant upgrades that promote health and safety, increase or build transportation capacity, provide access to assistive tech or service animals to support independence, enhance data systems and infrastructure to streamline service delivery, promote access to care, and support care coordination, or expand and enhance independent housing opportunities. So you can see there's a wide range of activities. I'm sure you can find some sort of project that fits your organization and their vision.
So I'm going to talk a little bit about the types of projects. We've bucketed them into two different categories: programmatic projects and infrastructure projects. And one of the things I want to say too is you may have questions today or ideas of projects that you have. We're in today's session, and even PCG, we're not going to be in the position to say, hey, that sounds like a good project, submit an application, or no, that doesn't sound like a good project, maybe you shouldn't. We're not here to decide. There's a full-scale evaluation process that the PCG folks will do to decide whether or not your project is eligible for award. So the biggest thing that I can say to you is just to make sure you're very aware of what the requirements are, and submit an application to make that determination. And that's one of the main reasons is that we don't want to, if you have something innovative that meets this criteria, we don't want to determine that's in or out. We want to give you the best opportunity to submit for award. So there's probably lots of innovative things that you all are already thinking about. So we want to support your process in doing that. So related to programmatic projects, these can be things that create new or expand existing programs, services, or activities. So if you have something new that you have an idea about, or you want to expand something that you currently have, maybe to a bigger population or in a new location would be an example. All of the projects have to focus on improving member experience, health, and safety. And primarily the programmatic projects, the areas of focus are community participation, self-advocacy, relationship building, health promotion. On the infrastructure side, you can purchase or improve equipment, connectivity, access, data systems, assistive technology for members, vehicles, and physical plant modifications. But again, you have to directly tie those to impacting member experience, health, and safety. And it is important to note that we do exclude the purchase of any structures. So the grant cannot pay for purchasing a home or a building or something like that, but you can apply for physical plant modifications. Next slide. ineligible activities. So basically, awards funds cannot be used for projects with ongoing costs or other long-term commitments. So we want to make sure that whatever investment is made with these funds, that there's a sustainability plan, or it's just a short-term program, which is fine too. So you will be asked to provide some information about how you will sustain the project. This is very important because this is a requirement of CMS. You cannot use funds to supplant or replace existing state funds for Medicaid services. So you can only use the funding to supplement something you have going on, enhancing something you have going on, expand or strengthen existing services, or for something entirely new that you haven't been doing. But you can't use this to replace any funding that you have currently to provide services to members. Next slide. Partnerships. You can partner with one or more organizations. They can be Medicaid agents, they can be Medicaid providers, or they don't have to be. But the lead applicant will be responsible for the award on behalf of all the partners. And you will be required to attach letters of support from the other partners to the application.
Okay, this one is back to me. So we will look at some of the sections you'll have to complete in the application on Grants Connect. Just give you sort of a quick overview. So there are 6 sections to the application in total. The first is organization and experience. That covers information about your organization, including your programs and service area, key personnel and their role in your proposed project, and a communications or marketing strategy to promote your project to people who could benefit from it. The next section is the project overview. Here you will provide a short description of your project and indicate which of the award goals it will achieve and the needs it addresses. You'll also list any key milestones and deliverables, how your project fits within your organization's larger strategy, and any potential risks to your project and how you might go about addressing them. Section 3 is your project impact. Here you'll provide more detail on the people and geographic areas that will benefit from your project. There's also space to list any organizations you'll partner with as part of your project, if applicable. Section 4 covers your budget. You'll provide a detailed description of all your project costs, including projected start and end dates and total costs for any milestone, phase, or deliverable associated with your project. Section 4 also includes space for you to provide that sustainability plan to explain how you will continue this project after the funding ends. Section 5 is your project timeline. You can provide any additional details on the milestones and deliverables you laid out in the project overview and budget, and list the overall start and end dates for your entire project. Section 6 covers your reporting outcomes. Here you will explain the target outcomes for your project that you will be responsible for reporting on. You'll also explain your method for collecting and measuring data related to those outcomes.
So just jumping back a little bit on that reporting, each applicant who receives funding, receives an award, will be responsible for providing quarterly reports to Access. And those will be based exactly upon the types of outcomes that you identify in the application, whether it's one of those that are here, looking at outcomes related, member outcomes related to community volunteerism, or employment, community integration, self-advocacy, relationship building, health promotion, or technology access. There's even an opportunity for you to add an outcome that may be specific and unique to the project that you're proposing. All expenses and documents related to the program must be retained and accessible for audit and review by Access for a period of 10 years. Next slide. So important dates. Applications open on the 17th. We have, Peter mentioned the webinar on the 19th, which will kind of go over more of the technical components of how to apply and things like that. The application closes on May 16th, and we're looking at sending award notifications in July. Those that are awarded to receive payment in August. And again, that'll be a one lump sum payment. And then the other key date, so keep this in mind as you're planning and you're developing your ideas. All funds must be spent by September 2024. There's no wiggle room with that at all. So definitely when you're planning and putting your project plans together, you want to try to get ahead of that mark, because sometimes we know that things take longer sometimes than we originally planned. So you really want to make that part of your planning process.
So as I said at the beginning, part of PCG's role is to provide technical assistance to applicants throughout this process. So we've set up a few ways you can find answers to any of your questions. So if you do have questions, your first stop should always be the program webpage. There you can find FAQs and a guide to using Grants Connect that should be able to answer most questions you might have. We'll make sure to update that FAQ periodically to add new questions as we receive them as well. So we'll make sure we're addressing questions as people have them. After both webinars, so this one and the one on the 19th, we'll also add recordings of the presentations to the webpage if you'd like to review them, or for people who are unable to attend one or both of the webinars. If your question is not covered by the FAQ, by the guides, by the webpage, please do reach out to us directly and we'd be happy to answer them. You can call or email us using the contact information here. It's also listed on the webpage. Whichever one you prefer is fine, either phone or email. So at this point, we left a good chunk of time in the webinar to make sure we get as many questions answered as possible. So we'll open up questions from you all. Obviously, we do have a lot of people attending today, but we'll do our best to answer as many questions as possible. Please do stay muted unless you are asking a question. If you'd like to ask a question, please raise your hand and one of us will call on you. You can also add your question to the chat, or there's a dedicated Q&A space on Zoom that just sort of lists all the questions out. We can answer them there as well. As I said, we'll update the FAQs on the award webpage periodically. So any questions that you ask will be saved and used to develop the FAQ and other support materials. So as I said, now we'll open things up to question. If you have one, please do raise your hand and I will be happy to call on you and unmute you so you can ask your questions. So I think Beth Keeley, you are the first person at least to raise their hand. So we'll just go in order. So please, when you're ready, unmute and ask your question.
Peter, do you think maybe we should, I know there's been a lot of questions in the chat. Do we have staff that can maybe help us in trying to answer some of those?
Yeah, we have two people combing through chat and the Q&A right now. We could start there.
Yeah. Peter, I have a few questions from the chat that I can raise up. So, a couple of these I think have been answered, but wanted to ask these for everyone's benefit here. Is this limited to one application per tax ID? Our organization has multiple subsidiaries with their own tax ID number.
Sure, so I'll take this one. So there's it's basically one application per organization. And then we do ask you to identify any related provider IDs. So if you're an organization that has multiple locations, for example, and you want to do a project at multiple locations, then we're going to ask you for those various provider IDs that encompass the project that you are applying for.
Perfect, thanks, Dara. And that actually answers the second question where, yeah, we have one tax ID, but 5 campuses, each with a separate Medicaid ID. Can we apply for each campus? Just to confirm there, Dara, they can submit different applications for each of those campuses. Or I'm sorry.
No, it would be one application for the entire organization.
That's right. Yeah.
And then, but you would have to stipulate which locations or which provider IDs are all related to that particular project.
Perfect. Yes. Thank you. Another question: can organizations have multiple projects under one application for the agency?
I mean, I think they all have to be, I think they're very specific project or program based. So they have to be, it kind of depends on how you define project, but we're really expecting one application. So one focus of an initiative or activity or project related to infrastructure. And that's largely because while we have $40 million, you can see the demand on the phone here today. We want to try to spread the wealth, so to speak. So we will limit the application, one application for each organization, and then that would be specific to a project or program.
Perfect. Thanks, Dara. What is the difference between ARP and ARPA?
They're basically the same thing. It's just ARPA is the American Rescue Recovery Act. And so we just refer to, we just use the shorter acronym ARP, but they're the same thing. I do want to highlight, because this may be where some of the questions are coming from, this grant award, or these program awards, excuse me, are separate and apart from any directed payments that you may be receiving as with ARP funding. So these are separate and apart. These are completely different initiative under our ARP spending plan. So I just wanted to highlight that in case that's looming in someone's mind.
Another question, how are we defining the elderly population?
We don't have a specific age on that. Generally, when we think about elderly, we think of 65 and older, but we don't specify, but I would say 65 and older.
Another question, do organizations have to pay taxes on these grants?
I don't know the answer to that question. I think we'll have to come back because I don't want to say something that might be wrong. So I think we'll have to add that to the FAQ.
Okay. Can outcomes be achieved beyond September 2024?
Well, when you're submitting the application, you're gonna put in anticipated impact. So I think we'd like for you to anticipate the impact for through September 2024, and then you can as part of your application, you can describe how what kind of impact you might see beyond that. I think that would be great, particularly as part of the sustainability, but we would like to see, because you're going to be reporting on those outcomes throughout the project phase, throughout when you get awarded to when your project is complete. So we definitely want to see you estimating outcomes for that particular time for the funding period, but certainly you can talk about what additional outcomes you may see in the long run, which would be great.
Thanks. That's the first list of questions I had in the chat. I'm still going through and selecting some other questions if we wanted to take some other specific questions while I'm gathering our second part 2 list.
And Peter, I'm seeing some comments about folks not being able to unmute themselves.
Yes, so the way it works is when I call on a person, they get a request or permission to unmute themselves, and then they can just say yes and go ahead. So if we want to turn now to the people who raise their hands while Corey's compiling questions, we can go that route. So the next person up is Kim Davidson. So Kim, you should receive, yep, there you go. Looks like you've already done it.
Got it, thank you. So I know when doing things such as federal grants, there are actually written guidelines for the grants. When are those written guidelines going to be published, and how do we get a copy of those?
Does somebody from PCG want to take that? or we are posting, Peter, we are posting the kind of the user guide for the system. But these webinars are your notice about the eligible activities and things like that. Once you get into the application itself, there is an opportunity to print an application so you can kind of see everything at once, but you will submit it through the online portal.
Thank you.
All information you need should be included on the program webpage. Okay, Clinton Bartlett, it looks like you are next up on the list.
You answered my question.
Cool, excellent. Always like when it works out well.
Great job.
Dot Cret.
Hey, Peter.
Yeah.
Oh, hey, Peter, can I just answer a question that I keep seeing pop up around using these funds for workforce costs? So we specifically did not include supporting the workforce in these eligible activities because of directed payments and because of also other initiatives that are going on with ARP initiatives. So these funds cannot be used to pay for incentives for recruitment or retention or anything like that. These are specific projects that impact members directly in those different areas of focus that we shared previously, and workforce development is not one of them. Sorry, Peter, I just had to get that in.
No, excellent. I'm glad we're answering questions. So I'll keep running down the list then if that's good. So like I said, Dot Cret, it looks like you are next up.
Okay. So it sounds like then from what Dara just answered, we currently have a CRESA grant, and I was wondering if this could be used to extend that, but part of that grant covered staff salary. So sounds like from Dara just said that would not be eligible, but can you confirm that, please?
So Dot, again, I can't say whether or not the project would meet the requirements or not. You know what I mean? Like we have to look at each application on its own. There is in the so without understanding your current grant project that you have, there are, you could have administrative costs, to carry out the project or the program, right? So staff salaries is part of that. But as far as using the funds to pay for incentives to recruit people or retention bonuses or things like that, it cannot be used for that. Does that help to clarify a little bit?
Yeah, thank you.
And the funding, only 10% of the award can be used for any administrative costs.
As we're waiting for other questions, I just wanted to add a general note here that I'm seeing a lot of questions in the chat about specific projects and would this be reimbursable? As we mentioned at the beginning of this call, we are not able at this time to weigh in on specific projects and whether or not that will be determined through the application process. But we do have a lot of information in our FAQ on the website around, reimbursable activities versus non-reimbursable activities. So just wanted to mention that note as well.
Yeah, thank you, Corey. I agree. We're seeing a lot of people ask about specific projects. As Corey said, that should be covered in our guidance documents. So Kathy Kelly, I think you're next up.
Okay, so I just want to clarify that if we can't have like incentives for caregivers or whatever, because that's under the other ARPA access relief funds, and we can't have workforce development, but we could have like peer support providers as a part of this grant ask, or navigators or community health workers, would those be eligible categories?
So again, I don't know, Kathy, what you're thinking, and we can't weigh in specifically on specific project ideas, but the eligible activities are not to acquire staff or pay for staff. You may have to support staff to implement a project or a program, but the goal of the eligible activities for the funds are not related to workforce, to paying for workforce.
Well, right.
But again, Kathy, again, we don't want to weigh in on, can we do this or can we not do this? We just really encourage you to deep dive into the information on the website and the webinars to help you make your determinations to whether or not you should apply for funding, and let the evaluation process, take place. One, because Kathy, you may have some really great idea, and by the nature of the way you're asking the question, you know what I mean? We don't want to say no or yes. So I think you just really need to do a deep dive into what are the eligible activities and what are the outcomes as you see what we're looking for or what's required for the awards, and then you can make your determination.
Okay, so just to clarify, are you saying that if we determine that staff is needed in order to provide the member service that we want to offer, and you need staff for that, are those wages an eligible expense or not?
Up to 10%.
Only 10%.
So yeah, and I want to be clear to something that you just said, and it just kind of ran out of my brain as you were talking, but I don't know, maybe they'll come back to me. Kathy, I would just encourage you to take a look at the eligible activities and what are the outcomes we're trying to achieve, and then you can make a determination as to whether or not you want to apply for the funds.
Okay, I guess I'll have to wait.
I know it's hard. I know everybody wants us to say, can we do this or can we do that? I totally understand, but we really don't want to limit innovation based upon assumptions in the conversation. And we also want to be, make sure that the evaluation process has integrity and that you have as many opportunities, as many folks have opportunities to apply.
Melissa Elliott, I think you are next.
Yes, hi, good morning. My question is about, I see in the RFP that we can use it to increase or build transportation capacity, but since it has to go to a Medicaid eligible population, if this is a service that that's already being provided, can it be a service that Medicaid is already providing?
You would have to explain how it's enhancing, expanding, or supplementing what you're currently doing.
Okay.
So you have to make sure that it's an expansion. It's either something new entirely, or it's supporting your ability to expand, strengthen, or enhance what you're currently doing.
Okay, thank you.
I just want to say too that I've had a couple people email me directly with questions. I know that you all are used to communicating with myself or Danielle or others at Access. Please make sure to either ask your question here so we can make sure to get it in the FAQ that we update, but also please direct any questions that you don't find your answers to on the website to PCG directly. They're really the experts on these program awards, and we want to use their expertise and their resources.
Corey, do we have more questions from chat, the FAQ we'd like to cover?
Yes, a few more. First question, can we start to spend some money for the proposed project ahead of award or payment date and have it covered by the project award?
We can put that answer in an updated FAQ, but I would say no, because you don't have any guarantee that we're going to fund your project.
Okay, and then the second question, our project has several facets. If 2 of the 3 facets meet the qualifications and 1 of the 3 is determined not to meet the qualifications, could partial funding be given?
And I will direct that back to the PCG team.
Corey, this is Monica. I think we should add that to the FAQ and double check with Casey.
Yeah, okay.
I want to say that, yeah, I mean, I want to say that, yes, we would allow that, but I think we need to make sure that we're all on the same page with that. Good question. That's a great question.
Right. Another question is, if the agency provides services to both Medicaid and non-Medicaid members, would we have to figure out how to limit the technology improvements to only Medicaid members, or can we incorporate the improvements into our overall service delivery?
So this is one we addressed mostly in the FAQ. So your proposed program should benefit mostly Medicaid eligible participants. If a whole bunch of your, let's say the bulk of your program benefits people who are not eligible for Medicaid, you may want to consider self-funding that portion and then just devoting your project to the Medicaid eligible participants. That being said, as we said at the beginning of the presentation, if you have a program that mostly benefits Medicaid eligible participants, and then also, you know, as a result, some people who are not Medicaid eligible also benefit, that's totally fine. You know, you don't have to shut the doors on them to keep them out.
Okay, and then another question. I'm from Indiana. I have a home, and I have a home care, and I'm moving there to expanding my business and add senior living. Can I apply?
At the time of application, you have to be an Access Medicaid enrolled provider.
Perfect, thank you. I believe that is all of the questions I had for my round 2 list.
All right, we'll keep going. Oh yeah, keep going down.
Oh, I think there's actually some, instead of the chat, I think some people put questions in the Q&A section. So if we could maybe, if we haven't addressed those already.
Sure, I'll read a few off. So first question in the Q&A, can we submit multiple programs and allow access to choose between the options? Or can we only submit one idea? No, you get one application, one project.
Good try though, good try.
Can funds be requested to complete an existing building project that is in process, but not yet complete?
You cannot use the funds to fund structures or buildings.
How about, this is just a later question, how about renting space for a project as opposed to building it?
I think that would go into the same category of ineligible activities. The same idea, just whether it's a one-time purchase or, you know, leasing a space.
So this is a general question on a theme, so I'll just sort of expand it. So let's suppose you have an organization with multiple locations. Should they complete an application for each location or one for the entire organization?
One for the entire organization. And then you'll be asked to, if you were, depending upon what provider type you are, if you have multiple locations, you may have multiple provider IDs. So then you would submit all the provider IDs that relate to the project you're trying to do with the funding.
And then here's one, where do you find the link to Grants Connect? I will take care of that. All links are on the grant webpage. So I know Sasha has put the link to both Grants Connect and the grant webpage in the chat, but you can always find any links you need on the webpage itself. Is purchasing a vehicle covered? So if you want to buy something to enhance transportation options.
It is one of the allowable expenses under infrastructure, but you have to be very clear about how it's improving, member experience, health, safety, and how it's expanding or strengthening or enhancing what you're currently doing.
So here's one from Cindy. I feel like we've sort of gotten around this, but we'll just do it explicitly. Can we include personnel salaries in either the programmatic project or the infrastructure project applications?
Only those costs that are related to you carrying out the developing and implementing the project or program. And those administrative costs across the board, which personnel costs is one of the categories, cannot be more than 10% of your program award.
Okay, so relatedly, are staff costs seen as admin costs? So only 10% of the budget? It sounds like that answer is if the staff are specifically related to the programmatic project, no, otherwise potentially. Can funds be used for leasing? So leasing buildings, I think we've already covered. No, that would be an excludable cost. Leasing vehicles, allowable?
I think we'll have to take that back.
Okay.
I would think purchasing of vehicles is allowable. Leasing, probably not, but we can take that back.
We covered this one already. Can you repost the web page? I know, as I said, Sasha or Danielle has already posted in the chat. You'll also get a confirmation email at the end of this webinar that'll include the link to the web page, but we can post it in the chat again, just so everybody has it. Okay. Some of these, again, we're getting a lot of questions about people asking for whether their specific project is allowable. Again, we're not spending this time answering whether your specific project is eligible for the grant or not. Please just do review the applications, the guidelines, and you should be able to get your answer there.
Peter, we have a few more in the chat that I wanted to raise up. The first question, if we submit an application, we ask for funds, will someone determine if we are approved for what we asked for, or will we get approved for a lesser amount or just get denied altogether?
I'll let the PCG folks answer that one. I mean, if you're, sorry, Monica, go ahead.
Oh, I was just gonna say that in the end, Access makes the final decision. We at PCG will review and send our scores to them, and then they will be the ones to decide.
But we can only award programs that meet the criteria. So if you submit an application for a project and the project does not meet the criteria, then it won't be funded, right? And then there's a scoring, just like you would have with any other kind of competitive process. There's a scoring process. But if on face value the project does not meet the eligible criteria, then it definitely won't be funded.
So a couple more questions from the FAQ. When will the revised FAQ be uploaded to the website, and will the notification go out? The notification won't go out. We don't have your sort of emails captured through the website. It should be, at least the first revision should be sometime this week after we get this webinar finalized and posted, and then do a second one following the second webinar after the 19th. So if you just check back later in those weeks, you should be able to see it. Another one, this is probably for the PCG team. If we can just talk a little bit about the selection process, we don't have to go too far into it, but the question is if the selection process is initially automated, so do we have some sort of algorithm that picks out keywords and then forward those applications? Someone on our technical team could give an answer there.
No, that the applications come into Grants Connect, and PCG will have a review team that will go through all applications. And again, what Dara said is correct. We will look at eligibility criteria and do the initial determination that way.
Okay, we'll turn to a couple more people who've raised their hands, let them answer their questions. So Nadine Lolly, if you'd like to ask your question.
Hi, good morning. How are you? My question was answered as far as the renting, because I'm actually in the process of opening up a caregiving service, a school. And I just wanted to know, would that be one of the, what was the criteria for that? Would that be eligible for, because of the fact that it is something that we need most dearly in Arizona as more caregivers, and by educating and presenting them to people or giving them opportunity to help people with their caregiving, I thought maybe that would be eligible. Because most of the time we have to buy our own products, we have to buy our own beds, we have to buy our own mannequins, we have to buy everything. But in doing so, we need a space to do that.
So you need to, again, you need to look at the criteria and the areas of focus for the grants and the eligible activities to make your determination.
And then one more thing, when in doing so, I have just started, well, not started, but I reinvented my website. However, I wanted to find out, would any of the funds be eligible for if you wanted to enhance your SEO?
For your search engine optimization?
Yeah, exactly.
Oh, I was like, what's that?
I imagine no, given that that doesn't directly impact the experience of the people receiving home and community-based services.
Okay, thank you so much.
Mm-hmm. Kim Schul, you are next.
Hello, my question is, let's say, for instance, you do get awarded monies and you are planning on selling your business within a few years. How does that work? Do we just pass on all the paperwork to the owner, the future owner, or I'm just curious, you know, how that works, if that's an issue.
I mean, if that's something, well, I mean, we'll have to go back and talk with our folks about that. But if that's something you're aware of, then I would definitely, you know, you have to build in a sustainability plan. So there needs to be some reference to that in the sustainability plan section.
Well, I mean, honestly, it would be definitely something that would be part of the business. You know, if we did something to the house or get a vehicle or something, it would go with the business if it was sold. I mean, I'm just saying for 10 years, you know, we could be audited for that. So my question is, in 8 years, you know, if we decided to sell, would it just be passed on to the people, the new owners of the business?
Yeah, as far as the records, yes. Just
Okay.
like you would anything else, right? Just like you would any other kind of record, yeah.
Okay, just wanted to make sure. Thank you.
Okay. Jayashri Ganesan, I apologize if I pronounced your name incorrectly, but you are up if you'd like to ask your question.
Sure. Good morning, everyone. Thank you for taking my question. I have a couple of questions. One is for workforce development. You said this grant is not covered, but we were thinking about what if we write for like some sort of a training program, like, you know, we have our, you know, home and community-based providers spread throughout the valley. And what if we were to come up with an online training for them? Is that covered under this grant?
So you have to directly impact member experience, health and safety. So you also need to look at the eligible activities to see whether or not it fits within those categories.
Okay.
It would be hard for me to draw that conclusion, but without understanding, again, what all you want to do and what's included in that, you need to make that determination yourself, whether or not that's a viable project to an application to submit.
Okay. And my second question is, we have multiple lines of DD business, if you will. And I was wondering, you mentioned that it should be one application per provider agency, but what if we were to have multiple projects within the application, meaning maybe we can write something for our group homes, or maybe we write another project for our employment services. Is that something allowed? Is that something that we can do, write multiple projects within one application?
We're looking for like single program enhancements or projects per application, per single organizational application. Again, we have a finite amount of money, even though it's a lot, we have a finite amount of money, and we're trying to make sure that as many providers as possible are able who submit applications that are consistent with the scope of the program awards are awarded funding. So we're looking for single projects or programs. Now they could impact multiple sites that you have or multiple locations, but we're looking for single project ideas or program enhancements with one organization.
Okay, this is my last question. You mentioned vehicles are covered as long as they are benefiting or supported individuals. So for example, for our employment services, we go out and we provide let's say landscaping or property maintenance services. If we want a vehicle specifically for that, where the supported individuals on the job coach can carry the landscaping equipment or the property maintenance equipment and stuff like that, is that something we can write a grant for all the equipment and supplies as well as a vehicle? Will this grant cover that?
So again, I'm not going to say yes or no, but you need to, when you look at the infrastructure, which includes things like vehicles, you have to make sure that you're drawing the conclusion or the direct, that you're justifying how it impacts member experience, health, and safety. And so you have to make that connection as part of the application process.
Okay, all right. Thank you so much.
Mm-hmm.
Corey, do we have any other general questions? Things we need to cover?
I think we covered just about all of them. There was one more here, a specific question. I'm a psychiatric nurse practitioner and I accept Medicaid, but I do not have any Medicaid patients at the moment. Can I still apply for the grant?
You have to be one of the providers, first and foremost, that are eligible for the grant. And then secondarily, the funding can only be used, the funding can only be used for projects or programming that directly enhance member experience, health, and safety that are Medicaid members.
Perfect, thank you. Another one, are the applications all reviewed? Assuming so, are they reviewed in the order received? Are funds spent according to the order of applications received? Basically, is there a good reason to get the application in well before the May 16th deadline?
I would say that no, I mean, you need to get it in before the deadline.
And this is Monica
There's
again.
Yeah, go ahead, Monica.
Oh, just so you know, the order doesn't matter. All applications will be scored. If you apply on April 16 or 17, sorry, or May 15, your application would be reviewed in the same way.
Thank you, Monica. You said it much better than I did.
Okay, I will keep going through the questions, the people who raise their hands as well then. So Dawn Trapp, you are next up. Is Dawn Trapp still here?
Oh.
Dawn, if you could ask again, there might have been some trouble with your audio there. Okay, we'll try somebody else. Dawn, you can always email us your questions. We'll be happy to answer them then. So Tana Luger Motika, you are up.
Thank you. I'm just wondering if there's a breakdown that Access has in mind between programmatic and infrastructure projects, or is it, based on Access's priorities?
Yeah, we don't have anything that says, I think that's what you're getting at, like 50% will be programmatic and 50% will be infrastructure. No, it's just, they're all evaluated. And so the awards will be made based upon eligibility and funding.
Okay, thank you.
Mm-hmm.
Okay, and Gregory Sturgis, you can ask your question. Okay, Gregory is elsewhere right now. Then I think we can go through a few more in the Q&A section. So we have about 3 minutes left. So what is the difference in the programs between the ARP Direct Payment and ARP Program Award?
Yeah, I answered this earlier. They're completely separate and different. They're part of the ARP spending plan, the HCCCS spending plan, but they are completely different things and should be treated as such. So you need to do what is required under the directed payment programs with the attestation to get those funds. And these are program project specific things, not related to workforce at all.
So there are a few questions as well about programs combining multiple different aspects. So let's say they have a project that requires both, let's say an IT enhancement in a vehicle, for whatever reason. Can they combine sort of multiple requests in that way under a single project?
So if you need to purchase, let's say, equipment and vehicles for a specific project, you can ask for the cost of the vehicle and the cost of the equipment. Is all the costs that are associated with that particular project. They can be different costs, right? So that's certainly allowable.
That answers a few different questions. I'm just marking them down. We have people asking again if the grant counts as taxable income. Again, that's something we need to sort of circle back on. We'll make sure to add that to the FAQ when we update it. Okay, and then there are a few questions on reporting. So will they need to provide receipts and invoices, exact receipts and invoices afterwards as part of their financial monitoring?
So the reporting will basically be more like a narrative report, and it'll be more specific to the outcomes of the project and the progress made with the project plan that you'll develop and timeline. But I would keep all of those things, all of the receipts and things like that should be available for audit purposes, and those should be retained for 10 years.
So that brings us to time. We do have more questions. I'm sorry we couldn't get to all of them. A lot of them were specific questions about whether your particular project is eligible. Again, we don't want to adjudicate that right now. So please do just review the FAQ, review the award webpage, and you should be able to find your answer there. And as I said earlier, we will make sure to post the presentation and an updated FAQ to the award webpage. So just check there. Hopefully you can find those answers added and get your answers there. Dara, anything to add before we send people on their way?
Nope, just want to thank you, Peter, and the team, and our other Access colleagues who are also on the phone helping. And thanks to all of you, and sign up for the next webinar, and we'll look at trying to get more capacity for the next webinar so more folks can join us. Thanks, everybody.